Hi, everyone. Welcome to today's Aesthetics and Wellness podcast by Dr. Yusra. On today's podcast, I've got the lovely Holly, our skin and body therapist at the Dr. Yusra Clinic. We have taught you all about body contouring, how fat works, what the downside of liposuction is and the dangers of that particular treatment, as well as the alternative treatments and all of the benefits, the health benefits and the way that they work and how to safeguard you from spending and throwing your hard-earned cash down the drain. Don't miss this one. Hope you enjoy. Hi, everyone. So today on our podcast, we have got the lovely Holly, who is one of our skin and body therapists available at our Liverpool clinic. And she has a wealth of experience in both skin treatments and also body contouring treatments. Holly, tell us a little bit about you.
So I have been at the clinic just over a year now. Obviously, love the clinic. I have literally learned so much from being there and working with you alone. So I'm very grateful for that. I carry out a range of different skin treatments, body treatments, and we take a 360 approach to treating the patients in clinic. So.
I think that's the key, right? That 360 approach. Because I know you've worked at loads of different clinics in the past, and our ethos, and we talk about this every week, is radiance on the outside, wellness on the inside. And that really means looking after our patients holistically. And you do a range of different skin treatments, and you're amazing at skin treatments. You do my skin treatments, you do my body treatments, and I couldn't live without you. I'm hoping to get one in today. And we're seeing a lot of patients nowadays for body contouring treatments, and we're hearing a lot of things. You know, some of them have tried fake devices elsewhere, and this actually happened last week as well, where a patient came in saying that she had cool sculpting, and actually she had a fake treatment, which was some kind of copycat machine, nowhere near the quality, nowhere near the efficacy, not safety tested, not regulated, just basically nonsense. Came in saying that she had cool sculpting elsewhere and it hadn't worked. When we looked it up, it wasn't cool sculpting. And it's actually really sad because it's capitalizing on vulnerabilities of the patient. And now we know that it's body season. Everyone is getting really conscious of their appearance. Summer is coming. There's a big rush to look good before the summer. I know, I feel the pressure. We all do.
Definitely,
we're human, right?
Yeah.
People are thinking about how they're going to look on the beach. And we're hearing the same kind of concerns. I'm worried about my abdomen. I hate my arms. I don't like my cellulite. Some of the men that we're treating are conscious of gynecomastia, which is enlargement of the breast tissue area, or love handles.
Yeah.
So this podcast we thought about doing was after seeing an influx of patients having fake or ineffective treatments elsewhere. And I think, as with all things, quality matters, safety matters. We only ever bring in the best in our clinic. So I think this is an opportunity for patients to learn about FDA approved, regulated, safe, effective treatments, so that they're not pouring money down the drain, wasting their hard-earned cash on things that simply don't work.
Exactly, yeah.
So tell me about the trends you've been seeing in clinic.
So what patients have been coming in? Okay. So probably one of the biggest things at the moment is probably menopausal women that all coming in and saying the same thing, that they feel like they've put on weight, especially around the abdomen area. And no matter with diet and exercise, they're finding it really difficult to budge, which obviously we know when you are menopausal, it is very difficult to budge the extra fat on that, especially the abdomen area.
Correct. Actually, so menopause is when your periods stop, right? And the average age that patients stop getting their periods, or women stop getting their periods, is 51. But the perimenopause is 10 years before that. So essentially when you hit 40, 41, we consider you to be in the perimenopause, because what we know now is that it's not that you hit 15, suddenly your estrogen, progesterone, testosterone stops. That's not what happens. What does happen is that there is a slow and gradual decline in estrogen, progesterone, and testosterone over the course of 10 years leading up to the menopause. And that results in a whole host of different symptoms. Even if you're getting your periods regularly until you're 50, 51, the symptoms range from psychological symptoms like not sleeping well, irritability, wanting to kill your partner, really finding that you've got low mood, not wanting to socialize, not wanting to go out. Sleep disturbance is a huge thing. And a study that was done showed that 80% of women who are going through the menopause had sleep disturbance, which naturally will result in not functioning optimally, not showing up optimally, not making the wisest choices when it comes to what they put in their mouth, what they're eating, because they will lean into sugar for energy. They have brain fog. They don't understand why they can't remember their sentences or what they're trying to say, how they're trying to articulate. I've just had a baby 18 months ago, and I know brain fog is real, right? And it's really frustrating. It can be quite embarrassing as well when you're kind of sitting there thinking, what was I saying? And what's that word? And I hear that a lot with my patients. And so what they're doing is they're leaning into maybe the wrong food types, but not just that. We know that estrogen has a huge protective factor on our patients. It's anti-inflammatory. It helps to protect bone density. It helps with hair growth. And when you start to and also helps with the optimization of fat and fat distribution. So pre-menopause, the total body mass of a woman, her abdominal weight is usually only 5% of her total abdominal weight. Post-menopause, because of fat redistribution being mainly around the abdomen, suddenly that shifts, and 20% of her body weight now comes from the abdominal weight. So that is probably the number one concern I see with my patients.
It is. And obviously all the symptoms of menopause that you mentioned before, that is why Emerald has become extremely popular in clinic, because it does address a lot of them symptoms that we've just spoken about, like sleep, obviously weight gain, and various factors like that.
So talk to me about Emerald. Our patients probably don't know what Emerald is. It's our latest FDA-approved device that I have been having this treatment myself and has made a huge difference. We've got lots of men having it as well, don't we?
Yeah, it's not only women. Men are also coming into the clinic.
So tell us about Emerald. What is it?
So Emerald laser is a low-level laser. It's a green laser that basically creates a transitive pore in the fat cell. Then the lipids will then leak out into the body and then will be excreted through the lymphatic system. So what happens at this point is the fat cell will decrease in size, which obviously will then result in an overall circumference loss. And we say around 4 to 6 inches of circumference loss with Emerald laser.
Which is huge. For those who don't know, fat is a really interesting cell. And fat is actually a very important cell. And we know that actually when you are, you have a set number of fat cells, don't you?
Yeah, by the age of 21, is it?
Yeah. So what happens is as we're growing, we develop and continuously develop our bone density, our skin, our hair, our features, our mandible, our maxilla. We're growing taller, our jaws are growing wider, and our fat is being distributed. And by the age of 21, the number of fat cells we have is the number of fat cells we have. That is it. We don't grow new fat cells. And what happens is if you sit at home and eat chocolate cookies, a lot of burgers, chips, and pizza, those fat cells expand. And when you lose weight, exercise, diet, etc., those fat cells shrink. What doesn't happen is that you grow new fat cells or you lose fat cells. Now, what liposuction, which is fat removal surgically, does is remove fat cells. And once you remove fat cells, they are gone and they are gone for life. But if you sit and eat, again, chips, burgers, pizza, the remaining fat cells will continue to expand. So it's the expansion and contraction of fat cells that happen as we put on or lose weight. Now, as we age, our fat cell becomes more pro-inflammatory. So it becomes less healthy. It doesn't function optimally. And every single cell on our body, from our hair cell to our skin cell, to our brain cell, our eye cell, our fat cell, has to function, and it serves a function. Fat is not there to make us look bad. It's actually there to keep us warm. It helps with mood regulation. It helps with hormonal regulation. People don't recognize or realize that. Now they're starting to understand it more because women who undergo liposuction start to feel anxiety, sleep disturbance, hormonal fluctuations. And the main thing is really sometimes overwhelming anxiety because of that mood dysregulation. And also they start to put on weight in other areas of their body. So over the last, I would say, decade, there has been an exploration of alternative methods of body contouring instead of liposuction because of the potential downtime, the risks, and the impact that removal of large amounts of important fat cells have on our body. So if we now know that this fat cell is important, but actually we know that this fat cell is expanded, it's no longer healthy. Because when your fat cell expands and it continues to expand and expand and expand because of those burgers and chips, and it stores all of these triglycerides and these lipids, which are fats, they leak out inflammation. And when they leak out inflammation, remember your cells talk to each other. Every single thing is energy, right? So, and every single cell in your body communicates. Very clever. And it's very interesting. So if you've think of it like a row of rotten apples, and you put a nice healthy apple next to it, that healthy apple is going to rot because rotten apple spreads. Yeah. It's the same concept with fat cells that are leaking out pro-inflammatory messages. They are going to impact the next fat cell and the next fat cell and the next fat cell. And suddenly they're leaking out inflammation and they're telling all the cells around them to do bad things, right? So it's bad messages. Yeah. That's essentially what happens. And that increases the risk of developing disease, cardiovascular disease, type 2 diabetes, even cancers, 13 types of cancers. And that switches you to an unhealthy state. So when we're talking about fat and why fat or obesity or being overweight is unhealthy, it's not because of the appearance, it's because of the impact on the state of health, right? Yeah. And so that is what we as medical professionals are concerned about. Sure, I get it. I want to look good in my clothes as well, but I want my patients to be healthy.
Yes,
to live,
exactly.
And we know that we're living longer, but we also know that in that time that we're living longer, we're not necessarily living healthier. More and more patients are on medication. They're developing Alzheimer's. They're developing cancer. The rate of cancer has gone through the roof. So if we can switch our body state to a healthy state, then not only will we live longer, but we'll live a better quality of life because we'll live healthier. That's where Emerald comes in.
Yeah.
So it doesn't destroy the fat cell. And we do have treatments in clinic that destroy the fat cell. And I have had those treatments. And I would again, but it's very controlled, right? We're not removing mass amounts of fat.
Yeah. And it's patient dependent as well, depending on what outcome they want, what results they want to achieve. So that's down to consultation as well, what treatment we would advise.
Exactly. So, I mean, in our clinic, we've got cool sculpting, which is cryolipolysis. It's a fat freezing treatment. And it's great. And we use it for stubborn areas of fat, like the double chin or bra puff or love handles. We also have ultrasound Q+, which is a cavitation device. It's high intensity focused ultrasound, which results in the fat leaving the body. That's a great treatment, again, for localized areas. Although, you can use it all over the abdomen and in conjunction. But Emerald is really a game changer. And it's a game changer because it's not just about fat removal, but it's about
wellness, isn't it? Yeah.
Exactly. And this is everything. This is our motto. It's on our wall. Radiance on the outside, wellness on the inside. Yeah. So how do we optimize wellness? So interestingly, we absorb light. Our bodies, every single cell in our body absorbs light. And this, we know this from when the light comes into our bedrooms when we're sleeping in the morning, when it starts to leak in, or even if our eyes are closed, your body feels that and it starts to absorb that light. And when your body starts to absorb that light, it impacts a little battery in every cell called the mitochondria. Now, the mitochondria, think of it like the engine, okay, inside your cell. Every cell has to function, whether it's your hair cell, your brain cell, your fat cell, every cell has a function. And in order for it to do its job, it needs a battery. And that battery or that engine is the mitochondria. Yeah. And the fuel for that engine is called ATP. Okay, so we're getting scientific now. Don't fall asleep. This is important. So the ATP is super important because it gives fuel to the mitochondria to do its function. Now, as we're aging, one of the 12 hallmarks of aging is mitochondrial dysfunction, which means the engine or the mitochondria starts to slow down. It's not functioning as well as it did. Therefore, and also it doesn't have the ATP. So and inflammation eats away ATP. So it's this negative cycle. Our battery is not working properly. Our mitochondria is not working properly. We're not making as much ATP. NAD plus is a whole other concept. And NAD is very important. I've done a whole podcast on NAD plus. So please go and listen to that with a brilliant doctor called Dr. Nicola Condon, who actually formulated a supplement that helps to drive NAD plus and ATP. So these are very important. The reason why they're so important is because we're talking about impacting your health on a cellular level. And remember, aging happens on a cellular level. It's not just that your skin starts to wrinkle. What actually happens below the surface in the cells is that the cells start to change their DNA. So and we can impact that. So there's a difference between chronological age, which means how many years you've been on Earth, and biological age, which means how well you're aging. Yeah. And I've just done my biological age test. Don't tell them. Wasn't as good as I wanted it to be, but I'm making some changes. I thought I'd be like 20 on the inside, but anyway, we're working on that. And so the great news is you can change that. So if I can change my biological age, there has been scientific research to show that you might be 40 on the outside, but you can be 20 on the inside. Yeah. And that is not hereditary. It is absolutely not based on how well your mom or dad aged. It is based on your lifestyle. How much are you sleeping? How well are you sleeping? What are you eating? And what are you exposing yourself to? All of these things will make an impact. So when it comes to light, our body absorbs light, right? And when our body absorbs light, it starts to stimulate the mitochondria. So our mitochondria wake up, our cells start to function again, and it resets our circadian rhythm, which is our sleep cycle, and it releases a hormone called cortisol, so it wakes us up. So we know that even if our eyes are closed, our body feels and absorbs light. And on that same notion, actually, if you wake up in the morning, at sunrise, and you expose yourself to the first 45 minutes of UV radiation or infrared radiation, it's actually neuroprotective, it's cellular protective, it's skin protective. You don't have to wear SPF in the first 45 minutes of light. The only time I'll tell anyone not to wear SPF. And the beauty is that it helps to reset your hormonal regulations. So there is a reason, I'm so fascinated by this stuff. And similarly, when we don't get exposure to light, we get disease. We know that light actually helps us to formulate vitamin D, which is important for bone health, which is also important for mood regulation. We know that if we're not exposed to light, we get seasonal affective disorder. You can even get depression, anxiety, etc. So light is very important. So now Emerald is not just light, it's a low-level true laser, right? Yeah. And it's got a wavelength of 540 nanometers.
Some around that, yeah.
Yeah, which means it's a true laser, essentially. And there's 9 diodes in this device, and our patients sit on it. It's non-contact. So
non-contact, 30-minute treatment.
Yeah.
You can treat various areas of the body. So abdomen, thighs, it can actually treat around the knee area, calves, arms. And then obviously during the 30-minute treatment, for instance, if you was having abdomen, you would have 15 minutes around the abdomen, and it would also target the side area of the body. You would then turn over, and for the remaining 15 minutes, we would also treat the back. That's how you get a circumference loss with the treatment.
It's amazing.
It is amazing. And the fact that it's non-contact, non-invasive, there's no downtime to it.
Yes, I think that's another thing with lasers. People are worried about pain, right?
Yeah.
They're worried about bruising. They're worried about what they'll look like. They're worried about swelling. And again, we do fat reduction treatments that do result in swelling, like fat injections, fat dissolving injections. And I think the beauty of the Emerald laser is it's so multifunctional. Because it's a true low-level laser therapy, it's a green laser, it also helps with pain reduction. It's neuroprotective. There's 22 FDA approvals. Like, to get an FDA approval, even one, it's such a mission.
Big.
It's big. It's a really big deal. It's very expensive, it's very difficult. But what it means is the product does what it says on the tin. And to get 22 FDA approvals is unbelievable. And also, it's one of the few body contouring or body treatment devices that can be used for patients up to a BMI of 40, which means obesity.
Yeah.
And we know that obesity predisposes to disease. So if our patients are in the obesity category, we really want to help them to get them back down to a healthy state. And once we get them into a healthy state, it's like, you see the life changes that patients make.
It motivates the patient so much. I mean, I had a patient this week, and the results already that she's got from a few sessions alone is great. And she's so motivated. Her confidence is actually starting to come back. Yeah. So it is great.
That's another thing, is confidence. We can't dismiss the impact that these things have on our patients' confidence. And often they don't want to go out anymore. They don't want to socialize. And that, I find it really, really sad. And I've done another podcast with Dr. Kate about lifestyle medicine. And we know that social connectedness is very important to longevity.
Yeah.
If you isolate yourself, you're more likely to die sooner. That's a fact.
Oh, wow.
That is not,
I didn't
this
even
is
know
not
that.
This is not opinion. This has been shown in black and white. In fact, those patients who were seeing other people families, friends, socializing on a regular basis live longer. So that is one of the hallmarks of living longer.
Okay.
Social connectedness is very, very important. Isolating yourself is a sure and fast way to early death, and early disease. So, when my patients say I don't go out anymore, it's a red flag for me. And I think I need to do something here. I need to give them the confidence so that they can sit in a group of people and not feel held back by how they look, not feel judged by how they look, not feel conscious by how they look. And that comes down to, looking after them holistically. So Emerald has been game-changing in our clinic. It's like we said, the way that it works, like you said, is the laser penetrates the fat. And actually we can put a picture on here so patients can see what that looks like. If you look at it on a cellular level, the fat cell's round cell. Once it has this pore in it, the triglycerides, it emulsifies or melts the fat. The triglycerides, which become liquefied, they become a liquid, leave the fat cell and are taken out through the lymphatics. Then the mitochondria is also stimulated. So when the light leaves, or when the laser leaves the device and enters the skin, it also has an impact on collagen synthesis, which is why our patients see an improvement in cellulite. And actually, this is one of the only devices that has an FDA approval for cellulite reduction.
And patients have seen them results as well, which is amazing.
It's amazing. And it's anyone that knows about cellulite is hard to treat. It can be a real, bugbear. Patients hate it. Really, really difficult to get rid of. And you can have it even if you're, skinny. We call it skinny fat. You can have it even when you're tiny. And this has made a big difference. I mean, we've all seen the changes. All of us have tried it as well. It's incredible because it is not one. It's not just one thing alone. It is impacting the skin. It's helping improve collagen production. Remember, it's driving mitochondrial function. Therefore, the collagen cells, are stimulated and working better. You get collagen remodeling. It reduces the fats in the areas treated as well. It improves lymphatics as well. So you get this multifactorial impact. And because of the mitochondrial function, you're getting better sleep, better mood regulation, better energy production, because now that your battery is operating, you've got more ATP. So there's this all-round holistic, true, and I mean this, like a true impact in all the hallmarks of aging and so on. And then we're combining it with another treatment, aren't we?
Yeah, so we're finding it's really working well with Emsculpt. So obviously patients will come in, they'll have like the overall circumference loss, will kind of debulk the area in a sense. And then obviously we know Emsculpt Neo.
Emsculpt Neo. Yeah, there's a difference.
Neo, a big difference, Obviously, a lot of patients don't understand the difference with that though, do they? The fact that it includes radio frequency and it also can be done on various areas of the body.
Correct.
Not just the abdomen, not just the glutes. We can also treat arms, inner thighs, calves can also be treated with it as well.
So tell me the difference in Emsculpt and Emsculpt Neo, because I think this is a real, people don't get it, people don't understand, and they don't also understand copycat devices and the dangers of that. So Emsculpt Neo is FDA approved, which means again it's gone through the highest regulatory body to say that it does what it says on the tin. And what is it? What modalities of treatment does it combine, and how is it different to Emsculpt?
So Emsculpt Neo combines radio frequency and high fem technology. So that's high intensity focused
magnetic stimulation.
So it combines them two technologies together, which obviously results in fat reduction and muscle building. So that is what's different to the Emsculpt alone. It doesn't include the radio frequency, so you're not getting that fat reduction aspect.
Correct.
So both them technologies in the one treatment is amazing because, like I said, fat reduction, muscle building. So it's really good for patients that want to get that extra sculpt or they just want to help build muscle.
So that's me. When I had and also helps with diastasis recti, doesn't it?
Yeah.
Which is a separation in the abdominal wall, which happens particularly after pregnancies. So I've had 3 pregnancies, I've had 3 children. And what can happen is that the abdominal wall, the muscles in the abdominal wall separate. And you can see it as a gap, and patients have this bulging stomach and they can't do sit-ups to get rid of it. In fact, sit-ups can make it worse.
And they don't have that initial core strength as well.
They have no core strength. Yeah. It's basically a damaged muscle structure. And traditionally, the only way to treat diastasis recti is surgery, because it's about approximating or bringing together those two muscle edges. Now, Emsculpt Neo is FDA approved for reduction in diastasis recti up to 19%, which is huge, because if you've got a poor core strength as well, you've also got a poor pelvic floor. Women suffer with incontinence, sexual dysfunction, all hosts of issues resulting and relating to pelvic floor dysfunction and weakness. So the Emsculpt Neo treats the whole abdominal wall, the core strength, but also the pelvic floor. And it releases, is it 20,000?
It's the equivalent of 20,000 sit-ups. So they're supramaxillary contractions. So you're engaging 100% of the muscle within that treatment, which even a top athlete wouldn't be able to do.
You're right, because when they are trying to do a sit-up, they can't engage the whole muscle.
No.
And often people are using the wrong muscle groups when they're trying to do a sit-up. I see this also with my son who tries to do a sit-up. And he's like, I can see he's engaging his back and it's all wrong. It can be actually really difficult. Even as you said, top athletes only are engaging about 30% of their muscles. Even pelvic floor, that's a whole other podcast, but pelvic floor, when they're doing Kegel exercises, people don't know how to do Kegel exercises. They're doing it wrong. And they're not engaging their whole muscle group. So the idea of the Emsculpt is that EM is electromagnetic, and the electromagnetic stimulation results in 100% of the core muscles contracting 100% of the time. So you get 20,000 contractions in one 30-minute sit-up, in one 30-minute session, sorry. And I've done it. I do it at very high, don't I? I do it 100%. There is I don't do the 80%, 50%. I'm like, if I'm getting on this, I don't have time. I need that 100% now. And I do it 100% on both modalities, both the radio frequency and the EM, the high fem, because I really want to gain the maximum that I can from the treatment. And we can treat glutes as well. A lot of women, particularly perimenopausal, start to complain that their glutes or their bums basically are no longer as taut as they used to be. They're starting to notice sagginess or a depression in that. And that is very important for strength. So as we're aging, as we reduce estrogen and testosterone, our muscle mass also reduces. And our muscles are very important, not just, again, for aesthetics, but function, right? Remember, every single tissue in our body is there for a function. People think that we're all just like this aesthetic look. No, it's not about that. It's about your function, your wellness, your health. Muscles are very, very important. And we say the skin is the largest organ in the body. The muscles are the largest tissue groups in the body. And without our muscles, we can't function, we can't move, we can't walk, we can't talk, nothing. And there is a condition called sarcopenia, which is reduction in muscle mass, which happens as people age. And it happens to both men and women. They get reduction in muscle fibers. And remember that the muscles, when they contract, so when we're walking, when we're moving, the muscles pull on the bone. So they have an impact on the bone. When they pull on the bone, they stimulate a cell called osteoblasts and osteoclasts. And these cells result in bone turnover. So if your muscles are not functioning as well, if you're not lifting weights, if you're not doing what you should be doing, not just your muscle mass will reduce, not just your fat will increase, but your bone density will reduce. And this is the real issue with perimenopausal and menopausal women, is they will start to lose muscle mass, they'll start to gain weight, and they'll start to reduce bone density. And therefore they don't want to go to the gym. Right?
Exactly.
And that's probably the biggest thing that I hear is, I don't have I don't want to go to the gym. I don't think I can. I can't lift weights. I have no motivation. And I'm not judging, because I was that lady. There's no way you would see me in the gym. And I just thought, I'm just not made to carry weights. And then I had Emsculpt Neo, and you were talking about this earlier, is you see a lot of patients like this.
A lot of patients like this. So they'll come in, they'll have a course of Emsculpt Neo, for instance, and it does give them that initial core strength. And then also, because they're looking and feeling better, they have that confidence to then go back to the gym or start the gym fresh. Because obviously a lot of patients also who have had like injuries and took some time out, they find it a great treatment to help give them that boost again. Correct,
because it builds the muscle.
Yeah.
So that's what it comes down to, is rebuilding that muscle mass. And if you can rebuild that muscle mass, we're not saying have these treatments for life. In fact, it's almost like an instigator or a boost. And they have the 4 sessions. Their muscles are much stronger. They're feeling much better because it's a literal workout. Your muscles are contracting. You don't leave feeling awful. You feel you're on a high.
Energized.
You're so energized. It's like this massive serotonin boost. And I know it's a bit of a shortcut, and there are no shortcuts. But when I have my treatments, I jump out and I'm like, great. And I go off on my daily, my daily routine. I go and pick up the kids, and I'm super energized. And the next day, you feel like you had a workout. Your muscles are sore, but you feel so much stronger. You can feel the impact. And when you feel stronger, guess what? You start acting stronger. You start lifting those weights. So it's maintaining and supporting.
Yeah, it's great. And obviously, as we know, like you said before, resistance training, muscle building, it is so important for every aspect of the body. Yeah.
So with that, so we tend to combine, I think our top 3 treatments of combination are Emsculpt Neo.
Yeah.
Which is the combined, the radio frequency. And another thing to note is that the radio frequency, which is heat, it targets the superficial fat, which gives us that pudgy look, but also the deep fat, which is visceral fat, which is unhealthy fats, right? It's the fat that lines the organs, that predisposes to cancer, that predisposes to disease, etc. So the beauty of the Emsculpt Neo is that you're getting that fat reduction in the visceral fats as well. So it's a health, it's about health again. So what I do for myself, as you know, and you can, I'm not shy about this. I tell people what I have. I have my Emsculpt Neo, then I have the Emerald Laser, and then the last device is
the Body Balancer.
So tell us about that.
So the Body Balancer, I love this. I would have one at home if I could.
Yeah.
So it's lymphatic.
I think all the celebrities have one at home.
They do, yeah. So it is lymphatic drainage. So basically, it's like a sleeping bag sort of that you get into, and it inflates. And basically when it's inflating, it is stimulating like the process of elimination of any like liquidized fat in the body and excreting it through the lymphatic system. So it also has other benefits. It reduces bloating. It's also good for recovery. I know a lot of athletes use it like after training and recovery. It also helps basically with any patients who suffer with like swelling, like lymphedema and various factors like that.
And post-surgical, right? We have a lot of post-surgical. A lady came in yesterday who had, was it abdominal? She had liposuction, I think. So yes, lymphatic drainage is huge. And whenever you're having a fat reduction treatment, particularly something like Emerald, and you're leaking out those fatty acids into the lymphatics, one of the things that you want to do is walk or move your lymphatics, get that drained out, drink lots of water. That's what I'm trying to do now. Drink lots of water, 2 liters of water a day, flush it all out, and then you're going to get the maximum results and the health benefits. The lymphatic drainage is such a massive help.
It's a huge part of it. If you're not applying that aspect after the Emerald, you're not going to get the best benefits out of it. So it's so important.
So important. And I think on a regular basis as well, I mean, just getting in that and having your lymphatics kind of detoxified makes a big difference. Again, huge. I wish I had one at home, but I'm lucky to have one in clinic. So I'm like, between patients or after patients, I run upstairs and be like, can I get in the device? And that's my relaxation time. Sometimes I'm working while I'm on it, but it's my relaxation time as well. Okay, let's finish off by telling our patients how many sessions they're likely to need of Emsculpt Neo, how many sessions they're likely to need of Emerald for the 6 inches of fat reduction.
Okay, so for Emerald Laser, a minimum of 6, ideally 10 sessions. This also including the Body Balancer, which is the lymphatic drainage that we just discussed. And for Emsculpt Neo, we always advise a course of 4, and then we would review the patient depending on what they want to achieve.
Amazing. Well, thank you so much for joining.
Oh, thank you for having me.
It's wonderful to have you. We'll bring you back and we'll talk about all the wonderful things that you do in clinic. Thank you, and I hope you guys enjoyed this podcast. If you have any questions, please don't hesitate to get in touch with us. You can book a consultation with Holly or Olivia, or indeed Hannah in our London clinic. Until next time.